Partha Nandi. I want to welcome all of you on Happy Easter. I know that there is a pandemic, but just want to still welcome everybody and make sure that I wish Happy Easter. I know it's a really special time for millions of people around the world. So just so I can tell you that, you know, thank you so much for joining us on this amazing holiday. So I appreciate all of you joining us, and give me a thumbs up if you can hear me or not. I want to make sure all of you can hear what we're talking about. And today we're talking about the coronavirus pandemic, and a lot of people know about the pandemic, but I just wanted to share with you folks that listen, uh, there's a lot to talk about, but there's still hope, and there's a lot to be thankful for during this time. Um, just some statistics to start off, right? So, pretty critical numbers: 535,170 cases of coronavirus in the United States, and we've had 20,649 deaths in the United States. So remember, these statistics change all the time, so it's really a moving target. But at this time, we have we this is the statistic we have as of today, and the numbers again are 535,173 deaths in the United States. I mean, 535,173 cases of the coronavirus in the United States, with 20,649 deaths. 30,604 people have recovered in the US. So it's a really, again, a positive statistic to me about people recovering. 3.85% death rate. Now, every week I've been talking to you about this. This is a higher death rate than we've talked about before. So what does all this mean, right? So people are, talking about, can we get some ideas about what is this? What does this mean for us? Well, several sites, and we don't want to overestimate this, but that we may be starting to reach the peak in the United States. So remember, states like New York and New Jersey may have already passed their peaks. Florida and Texas could see the worst by the end of the month. When we look at Michigan, where I live, the statistics I'll tell you is that Michigan has 23,993. We're third in the country with cases and total deaths of 1,392. And so, it's still far from over, right? Far from over. And I don't want to suggest to anybody that we're out of the woods, but there's the thing is that we are, what we're looking at is the fact that we may be able to defeat this little sooner than we think if we continue doing what we're doing, right? The idea is not that anything we're seeing in New York or New Jersey is going to make us say, okay, now let's go out and party. It's not the case. Or should we stop doing all of what we think we should do in normally, meaning that social distancing, disinfecting, washing hands? The message is not to stop doing that. In fact, the models show that if we stop doing that, then we could get right back to where we were again. So there's a institute, the IHME, that basically talks about what kinds of kind of forecasting that we may have, and what they're talking about is that if we stop this all the measures we've had thus far, if we stop it, then we, let's say by May 1st, then we would see our model go back to some of the dire consequences we had before. The White House coordinator, the coronavirus coordinator, Dr. Deborah Merck, said that health officials may be seeing a leveling of the curve for the first time since the pandemic hit the country. So on this Easter Sunday, these are all good things that are really, I think, positive and good that we can talk about, and that we are. I'm really proud of the fact that we are, as a nation, right, as a nation, doing the things we're supposed to do. So thank you all for joining us. I'm hoping I can see some of the comments and some of the questions that I am now. Facebook has got this new format, so it doesn't allow me to always see all the questions. But Eileen Lee says, what does the peak represent? Right, the peak represents that we're talking about when the rate of increasing infection actually goes up to the peak and then starts to level off. It's not that we're not going to see more cases or that cases are not going to be present, but the delta, the difference of how many new cases, we're hopeful will be the same, right? Will be decreased. So when you get to the peak and the peak starts to decrease, that the level of new cases from, let's say, today compared to yesterday maybe less. That's what we're talking about. It's not that you're not going to see any more new cases, but the change in the number of new cases may be different. And so I with this new format, I cannot see any of my comments, but let's see if I can get some help in looking at some of the questions that people have. People say, "What about gloves? Should I wear gloves to the store?" I think in Michigan, listen, if you can't wear gloves, if you go to a public arena, absolutely. Um, Please do wear gloves. I don't think everybody has to, but if you do, it's not going to hurt. Remember, the way this virus is actually spreading is how this virus is spreading by respiratory droplets. If I cough and you pick that up, you could get it. But or if there's the virus is on a surface and I touch it, then I touch my mouth or my face or do something else, and then I can spread it in that way. So this is how we spread it. So absolutely, if you wear gloves and you can make sure that you don't contaminate your face, mouth, the way you can get this would be very, very important. So really, really important to talk about that. Some other points I wanted to make today. So when we think about this virus, right, we think about upper respiratory tract infections. So people hopefully know it's fevers. You can have a cough, typically dry, or shortness of breath. But other people just have fatigue. We're now finding out that you may have some GI symptoms, right? So about 18% of folks in China, when they looked at the studies in Yuan, China, actually had GI symptoms, nausea, vomiting, and diarrhea. And sometimes they're only presenting illness. It doesn't mean that is all there is. That if we that's the only symptom of the virus. But the thing is, it can be. So if you have sudden onset of nausea, vomiting, diarrhea, maybe with some fever, talk to your doctor, see if you should be tested or not, depending on your history. So it's really important that you may have different symptoms than just the upper respiratory infection symptoms. This has also been seen in Italy, less than 18% clearly, but approximately 8%. In the US, it's been less than 10% thus far, but we need to keep an eye on it so we know that if you have GI symptoms, that could also be part of this COVID-19 spectrum. The other question I get asked a lot, and I'm sure that a lot of you are also thinking about, is, what about this warm weather? Are we going to be out of the woods, right? If we get this warmer weather, well, here's the thing: we think that because of the fact, right? Because of the fact that most coronaviruses have a cyclical kind of pattern, meaning worse in the winter and better in the warmer months, right? Well, let's think about the flu, for example. The flu and the colds, we know that you get worsening in the winter months, but in the spring and summer, it seems to go away. There are a lot of theories about why. Is it because of the fact that there's sunlight, and some people have looked at UV rays, killing the virus? Does your vitamin D level go up in these colder climates where you have sun? Whatever the case is, we see that. The sobering news, that it's not the best news that we want to hear, is that in China, it doesn't support that idea of warmer weather. It found that the transmission of the coronavirus did not seem to change in cities where temperature and humidity were higher. So it doesn't mean that it's not going to get better. What I'm saying is that it doesn't seem like you look at countries where there's warmer temperatures, like Iran, right? Iran was hit super hard and they had warmer temperature. And anybody who lives in Australia, any of my folks that are in Australia, will tell you that, that also is a place where it's warmer, and they were hit as well. So it doesn't mean that the warmer temperature, is going to be a savior for all of us. It may be, and I'm hopeful it is. But the bottom line is, it's premature to think that the warmer temperature is going to be everything to control COVID until we get better treatment, effective treatment. I know there's some treatments out there. People have talked about hydroxychloroquine and azithromycin. There's all kinds of medicines out there. We don't have great treatment trials for that yet. And vaccines also, we don't have vaccines. Until we have those, social distancing, appropriate disinfecting, washing your hands with soap and water, all those things are going to be great. And I'll talk to you about this again and again, but I also would really recommend that because we're at home, it doesn't mean that we stop our health hero methodologies, right? This is the topic of this live is health hero solutions, right, to the coronavirus or the coronavirus pandemic. And that means eat appropriately. It doesn't mean eat pizza every single day. Hey, if you want to have pizza once in a while, it's okay. But you don't want to eat a bunch of crap every single day. Takeout every single day is not going to help the virus. Also, something I've struggled with my whole life is to get adequate sleep. 6 to 8 hours of sleep is going to be tremendous for you. Tremendous. Go out there and please exercise, do something, right? Get out there and move with purpose. It doesn't mean because you're quarantined that in your house and isolating and having fun with your family. It doesn't mean you can't go out there and get some real fresh air, get some sunshine, and walk out there. It doesn't mean that you have to stop doing all that, right? It's really important, really important. To me, getting the appropriate nutrition, getting the right amount of sleep, going out there, not in a group of 50, but also doing some work to be able to do what? To be able to get the movement is as critically important as everything else we talked about. Listen, I want you to social distance. I want you to disinfect. I want you to wash your hands, but I also want you to treat your body appropriately so you can have the armamentarium, the shield, the weaponry to fight COVID, right? I want you to be able to be prepared for that. This is not a passive battle. This is an active battle. What I mean by that is you're a health hero. You can do this, right? You want to take control of your health. Listen to your national, state, and local officials, but also do the things you need to do. Sleep, sleep, sleep. Eat appropriately. Don't eat a bunch of crap. Fruits and vegetables, super important, right? We talked about last week, vitamin C, zinc, vitamin D. You can have foods that fortify that. Fresh fruits and vegetables. Have some shrimp, and try not to eat processed foods as much as possible. So really important. Let me see if I can answer some of your questions here as well. If I can get to those in a minute here. Let me see if I can get to those questions. This new format for Facebook Live, I'm trying to get used to that. So masks are only recommended, somebody says, when we leave the house, right? Listen, you can wear masks all the time if you want, but what you want to do is avoid not having a mask if you're out in public, right, with groups of people. So you want to make sure that you use that precaution to wear mask. If you want to wear it everywhere, it's not going to hurt you. But typically, I would say if you're in public places is where you want to wear masks. If you want to wear masks at home, go for it. It's not going to hurt you. But I think mainly you want to be able to do this in places where you feel like you're in public places where you can really make sure that you don't you're not compromising your health, and so you want to make sure that you're not going out in groups where you're in a grocery store or in your pharmacy and you are you're compromising your health and you're exposing not only yourself but to others as well. So that's important. A couple points I wanted to make also. We've been talking about this COVID. I heard in the Poison Center in Michigan that people are getting calls for accidental misuse of hand sanitizer. Really, really tragic. So what some people are doing is consuming hand sanitizer, right? Consuming hand sanitizer or rubbing alcohol. Really dangerous, right? Really dangerous. They're poisonous, and you can end up hospitalized and die. So also there are people who can't find hand sanitizer and are using dangerous products instead. Like I'm talking about paint thinner, I'm talking about windshield washer fluid, lighter fluid, chafing fluid, antifreeze. Really important not to do this. There have been people even drinking, reports of people drinking antifreeze, which is dangerous, super dangerous. Please don't consume or use these products in your hand. You could end up with dangerous effects on your skin, your eyes, your mouth, throat, stomach. And the best way to get rid of germs is, guess what? Wash your hands, right? Wash your hands, soap and water. Really, really important. If you want to make your own hand sanitizer, if you have the availability, two-thirds cup of rubbing alcohol, a third a cup of aloe vera. You can drop a few drops of essential oil to make it smell nice. So you can do that. But I don't want people to die trying to prevent these things. So really important. Let me answer some more questions here. Some folks are helping me try to get these questions on because for some reason I can't see them very well. And question is important is if you're asymptomatic, are you just as likely to infect someone as you are if your symptoms? It's not. No, that's not the case. We talked about this last week, I believe, is that if you're asymptomatic, there are reports from I think less than 10% or 25% of people getting infected, maybe getting from asymptomatic folks. But still, if you're symptomatic and you're coughing and sneezing and the respiratory droplets are you're exposing people actively, that's of course you're more likely to infect someone. So asymptomatic people can infect people, right? But if you're symptomatic, coughing, sneezing, respiratory droplets everywhere, that also, that's obviously you have more of a likelihood of spreading it. So the minority of folks are asymptomatic spreading it. That's the whole idea behind the CDC's recommendation of changing, right? The recommendation of wearing masks, because now we know that asymptomatic people can actually spread this. So you want to make sure that if that's the case, if asymptomatic people are spreading it, you want to wear masks. Now the masks typically, especially if you're doing homemade masks, I don't recommend anybody's wearing N95s or hospital grade masks, because you don't want to take those away from hospital personnel who are desperately looking for personal protective equipment. We talk about PPEs, right? So you can make homemade masks, and the Surgeon General has asked, showed ways to make homemade masks. However you get your mask, you protect yourself from giving it to others, right? But you don't always protect getting it from other people. You get your respiratory droplets to not spread to others, but it doesn't mean you're always protecting yourself from somebody else. But listen, my mask protects you, your mask protects me. What a great concept. And lots of people in Asia, Eastern Europe already embraced that way before we did. So important stuff. You may have heard this as well. The American Academy of Ophthalmology, had provided some tips, and they recommended that you wear glasses instead of contact lenses during this pandemic. And that's because one, you're less likely to rub or touch your eyes as much when anybody who's wearing contact lenses. I have like rubbing them and doing all this stuff, right? So you want to be able to protect your eyes. So if you have glasses, you're likely not going to rub your eyes as much. And also, they can also help you protect your eyes from respiratory droplets that contain the coronavirus. However, if you want to wash your contact lenses, have to wear them rather, you make sure that you wash your hands with soap and water for 20 seconds before taking them out. So you don't just want to take your hands without washing them, take your contact lens out. But bottom line is, if you can, wear your glasses in this time. Let me see if I can answer some more questions. Thank you so much for joining us. I'm sorry I can't see a lot of your comments or questions, but I appreciate all of you taking the time on this Easter Sunday. Happy Easter again to all of you. Thank you for joining us. I appreciate that. Listen, it's a really tough time for a lot of us, but I think one of the things my wife and I were talking, it's been such a wonderful time that we've spent time with our family, right? That we've been able to take walks, ride bikes. My boys and I ride bikes, and we're doing puzzles. We're making new recipes at home. There's nothing good about a pandemic. I get that, but here's something that I can tell you is that we're spending a lot more quality time together. If anybody has known about my Health Hero principles, one of my biggest pillars I call is tribe or community, and it's never been a better time to get acquainted with your tribe and your community. Mine, my family physically is my biggest tribe and community, and I've been really blessed to be able to get closer to them. And a lot of my friends have said the same thing. If you don't have an immediate family, please reach out via electronics, FaceTime, whatnot. If you have a Facebook group that you are with, whatever you need to do, reach out. If you have a neighbor, you guys can reach out, with some boundaries, right? You can be, you know, um, 50, 100 feet away and still talk to each other and get acquainted. It's really important at this time because we need our mental health. Super important to talk about that. Let me go back to your questions. What about takeout food? I'd like to support local. Good question. I'd like to support local restaurants, but it seems like you never know who's preparing your food. Absolutely. Listen, if you can cook at home, you can. But I think you can safely still get takeout. Make sure that you take the food out of the packaging, wash your hands with soap and water after that. Really, really, really important. to do that. But it doesn't mean that you're lost. Some people still want to do takeout. You can do that safely. Remember, all these restaurants are really doing everything they can because they, first of all, don't want to get sick themselves. Secondly, they want to protect the community. I'm just so proud of everything that our communities are doing to safeguard the health of the entire community. In this fight, there is no them versus us. It's all us, right? We either defeat this together or we don't, right? I mean, this is how important it's going to be. So really, really critical to talk about that. And let me keep going here. Um, do you think that stress can exacerbate COVID symptoms? I think that stress makes, and this is Emily Beemily. I'm hoping I'm not mispronouncing your name. I apologize. Um, and Emily, stress can exacerbate any symptom that you can. That's why it's so important at this time to not absolutely freak out. I think it's super important to be concerned and take everything seriously. But to freak out is not going to help, right? This is how it is. So when you have stress, what happens? When you have stress, your body's immune system doesn't function as well, especially if it's stress on a chronic basis. If you're stressed, you don't sleep well. If you're stressed, your cortisol level really go up, and it really goes out of control. If you have cortisol levels that's unabated, unopposed, and continues, your whole body doesn't function well. Not just your immune system, but every part of your body. Remember, there are 330 million Americans. There's billions of people around the world, and several of millions and billions of people have chronic diseases. So let's say even if 10% of people have chronic diseases, even let's say we don't even think about the coronavirus pandemic. What about the rest of your disease states like diabetes? Let's say you have an autoimmune disease. All those can get worse with stress, and all those can put you at increased risk for coronavirus. So stress is really important to try to manage. And so how do you do that? I really think doing movement, getting out there, getting out in the fresh air, walking, biking, running, whatever you want to do, or even if you do it indoors, it will really help with movement with purpose. One of my best pillars. And then also, if you are very religious, and prayer at this time is super important. If you're not religious, doing yoga, doing meditation really brings it down, the level of stress. Super important. One of the most important things that I've ever done in my life is start meditation. You can do a Tai Chi. You can walk in the garden, whatever it takes. So you know that you're part of a supportive environment. That really helps. Really helps. Nancy Kenneth says, if you've had it, can you be a carrier? Great question. So we're looking at that kind of information, right? So the best example is hepatitis B, Nancy. So once you've had it, some people can be a carrier. So we don't know that yet, or we don't know about the carrier state. What we're doing is trying to get the antibody testing formalized and getting it widespread. So what do I mean by that? Remember, when your body gets infected, one of the first reactions is you get an IgM antibody, which is the immediate kind of knock 'em dead antibody that gets created. But that, is followed by IgG, and that's kind of your longer term protection. So we got to find out, are there people that are not going to be symptomatic that continue to be PCR positive, which means that they show evidence of the infection. So we have to find that out. My guess is going to be that that's not going to be the case, but we have to find out. Sandy Fairbanks says, what's your theory about how this all got started? As far as we can tell, in Yuan, China, right? This got started at the live seafood market, and it's really tells you how infectious this is. This is almost 3 times as infectious as the influenza, and people don't have any immunity to the COVID-19. So once it finds a susceptible host, it spreads very quickly, three times as quickly. And so once you get it to one person, they can infect three. And if you know mathematics, logarithmically, one person infects three to the power of three to the power of three, just keeps going logarithmically. So it means that one person doesn't just infect one person, it infects three. So with worldwide travel the way it is, before we kind of recognized what the infection was, people traveled everywhere, right? And then you had those cruise ships that came with tons of infected people. Some actually went out in the public. You remember that we flew a bunch of infected people along with folks that were not infected in a plane on a 747, and they came out. So there are so many reasons for this to be spreading. And then once it went to Europe, then we were traveling from Europe to the U.S. So we have some evidence that much of the cases in New York were from Europe, but we feel that it started, the epicenter was in Yuan, China, and it spread around the world. Right now we have it, and this is to me one of the cases where the entire world, it's amazing. The entire world is galvanized. They forgot all of their differences and said, we are in it to win it. We are going to conquer this. And I'm so proud. Like, listen, Italy and Spain peaked, right? I mean, they're in a fight for their lives. They're getting ahead of it, right? Why? Because they're listening to folks and doing the right thing. China's already looking like they've really gone past it. Korea, you talking about places like Hong Kong. I mean, there are multiple places around the world that people have come together, and scientists like never before have come together and say, boom, we are going to work together, right? Work together to be able to make this happen, and they're doing it. So, excellent question, and we're gonna continue the fight, and we're also getting ahead of this in the U.S. Very proud of our national, state, and local officials, as well as all the people in the front line. I can't thank you guys enough. Folks that are physicians, nurses, healthcare workers who are really putting their lives on the line to be able to help others. So appreciated, right? So appreciated. So Emily, we talked about that. Jen Walsh says, "What about a workplace wearing a mask? If you feel comfortable doing that, I think it's important. It just depends on if you're by yourself in a workplace, if you're in contact with folks. But I think wearing a mask at a workplace, Jen, is not a bad idea at all. So." And Josie Cusimano says, I have an annual physical appointment coming up with my doctor, and my doctor hasn't called to cancel yet. I don't feel safe going to a doctor's now, but my meds need to be refilled soon. Are doctors still postponing non-emergency visits? Absolutely, Josie. I think most doctors are postponing non-emergency visits because this is one way we're fighting the virus, right? To be able to not have congregation of people in one place, like in waiting rooms, like in doctors' offices. Now, here's the thing. Lots of doctors, and you can ask your doctor, Josie, are doing telemedicine. I'm doing telemedicine where, we're talking to patients, interacting with them visually, audio visually, and looking at their records and making recommendations. I can refill my medication from the computer, and your doctor should be able to as well. So Josie, please ask your doctor, number one, are they doing telemedicine? Now, all of the payers like Medicare, the Blue Crosses of the world, Aetna, they're allowing telephone visits as well. So you may be able to talk to your doctor via the telephone or via some FaceTime to be able to do that. All the providers, not the providers, but the insurance companies have allowed to do that. So absolutely, you should not let your regular, medical conditions suffer during this time. Okay, please, very important. Ron Crewman says, when I wear my mask, my glasses keep fogging up. Any tip for people who wear glasses? Man, that's me right there. So, what you want to do is make sure that you have a good fit on your nose. With the masks have two ends, right? The one for your nose, and you can really squeeze it so it's nice and tight. When air doesn't escape, it helps to not fog it up. So what you want to do is, if you have a homemade mask, make sure you have a nice tight fit right where your nose is. So when you breathe, and test it out before you go out in public. What happens is a lot of us say, okay, we're in a hurry. We're always in a hurry. We're going to go, go, go. We're going to go to the grocery store, the pharmacy, or wherever. We're going to go, go, go. And then we don't test the mask, and we're like adjusting it in the store. You're adjusting it, so all the stuff that's coming in from the outside, you're touching with your hands, and you touch your face, you suck your nose, whatever you do, right? You're basically don't want to manipulate your mask. You want to practice that stuff at home in a safe environment. Then you want to mess with that stuff. Sandy Cox St. Clair, let me just drink my coffee here. Do you think there are people that could have had this before we knew, really sick, and got through it? At my job, we were in very close contact. I was first, then everyone within weeks got whatever it was. Only one hospitalized. I'd been at Disney at an event about a week before for days with people from world competition. Sandy, absolutely. Before we knew that this virus was there, I'm sure there are multiple folks that were around that were asymptomatic, or maybe they just thought they had the cold or something else that spread it. No doubt about it. But here's the nice thing. The moment the world knew, right, that this is a problem, we got to it, right? We got to it. Everybody started working together. Now, There's a lot of criticism about how quickly we did it, et cetera. And, listen, we can talk about that later. What's nice now is that we are doing it. We really are doing it. We're doing an excellent job in making sure that we prevent this. But your question is right on. Could have been that we've actually had, multiple, weeks before we actually thought that this was a problem that could have been there. Absolutely. Ramon New Life Marchbank says, are the masks really that effective? It really is. When we knew about the flu virus, you're at 3 times less risk of spreading or getting the flu virus, Ramon. And so when you wear a mask, you want to make sure that it's fit properly and you can prevent the respiratory droplets from going out. Now your point's a good one though, because not every mask is going to prevent every single thing from coming through. But if you wear a mask, you protect me. If I wear a mask, I protect you, especially the homemade mask and the non-medical grade. The N95s the medical community is wearing, that's going to really help them to not only not spread stuff, but also not get anything into your respiratory system where you can actually get infected. So they really are effective. It's a great tool for us to fight this, along with social distancing. The point shouldn't be that I got a mask, I can go hug people. It's not right. No, that's not it. You wear a mask along with distancing, along with washing your hands. Boom, right? You can really, really make a difference. So I think we can really, and we are doing it, right? We are doing it in the epicenter of our country, right? We're talking about what? New York, right? New York has 181,000 cases, 144 with 8,627 people dying in New York. I mean, it's unbelievable, right? These statistics are unbelievable. 181,000. Even in New York, we're starting to see that maybe they've peaked. And I cannot tell you how much I am thanking the health officials in New York. Governor Cuomo has been amazing in his leadership. All the health officials, all the doctors and nurses, the healthcare workers in New York, amazing. So, they're all doing their point. New Jersey's not far behind, 58,144. For those of you who joined me late, and I'm sure that you can look at this later on, but I'll go over some of the statistics. United States as of today, and it changes by the minute, so you may get a little different number. 535,173 cases of the coronavirus, of the COVID-19. 20,649 deaths at a death rate of 3.85%. And it's the highest, I've been talking about this every week, highest death rate so far. But there are some signs that maybe we may be peaking, which is, to me, it's good means that then we're going to start to see some relief. It doesn't mean that we stop worrying, doing all the things we're supposed to, that we stop our social distancing, that we stop our hand washing, that we stop our disinfecting, that we stop doing all the things that have really gotten us here. I also think it's super important and critical for us to be able to do the right things, eat the right foods, not a bunch of crap, not processed foods, not burgers and fries and pizza every day, whole fruits and vegetables. If you come to my kitchen, I could show it to you. We have garlic, we have tomatoes, we have onions, we have broccoli, we have oranges, we have apples. You can get those. Unlike toilet paper, people haven't bought like 100,000 apples, right? That's just how it is. You may not be able to get toilet paper, but sure as heck you can get oranges. Oranges, vitamin C. Boom, man. That's your supplement right there. Forget about going to some website and buying mega dose of vitamin C. Eat your apples, eat your oranges, right? Have your broccoli, big time. Put some garlic in your food. Put some ginger. You want to. This is not a passive fight. This is an active fight to be able to try to get the virus and defeat it. Not get the virus, but defeat the virus. Now, in the worldwide statistics, 1.8 million people have been infected, 110 deaths, 110,871 deaths. But here's the thing: 412,490 recoveries in the world. In the United States, 30,604 recoveries. It's really important to know that. And so I needed to tell people that that this is what's going on with with the state of affairs. So thank you for all your questions. Again, happy Easter to people who are joining us. Lucinda Baggett, important question. What are people with compromised immune systems supposed to do that work in the essential fast food industry? I think the government needs to add them to the list of the elderly. Clearly, people who are immunocompromised are at increased risk, right? So no doubt about that, right? But you can still, as long as you're not symptomatic, you can still safely work. Make sure you follow the precautions. Wear a mask if you're getting in contact with folks. Make sure that you practice social distancing. If you're in the fast food industry, maybe the drive-through window, or where you're dropping off, people are picking up food, is not the place for you. Maybe it's in the back where you're preparing food. We've got to adjust ourselves. But this time you can safely work in the fast food industry or the grocery industry. Just make sure you protect yourself. So I tell my patients who are taking medicines like infliximab or Remicade that have autoimmune disease, I still tell them you can work safely. Just make sure you take the precautions. Make sure you do the distancing. Don't be in a place. If you're next to folks that are less than 6 foot from you, there are a lot of jobs out there, right? Within that industry, try to pick jobs that allow you to have all of the distancing, the disinfecting, and making sure you wash your hands frequently, not just once a day, right? If there's a doctor that he told me that you need to wash your hands for 20 seconds and that's it, I'm done. No, you got to wash it several times a day. I tell my kids that all the time. Make sure you wash your kids. We bring the groceries in. We have an area, a designated area where we bring our groceries, we take them out of the packages, and then we wash our hands. Boom, that's how you do it. Get the mail, get packages from FedEx, UPS, whatever, right? You're getting deliveries from Amazon. Wash your hands. Wash your hands. Listen, I think that's good advice even after the pandemic. I hope people don't forget that after the pandemic, you can still wash your hands. Really important stuff. Um, let's see. Lori Franjak says, father has been in the hospital 2 weeks fighting for his life, finally off ventilator. Will he have permanent damage to his lungs from this virus? It's a great question. I mean, thank God that, Lori, that your dad is finally off the ventilator, and he is a fighter, because lots of people have not come off the ventilator and defeated this, right? But here's the thing. You have to know that we still need data from this to see, is it going to damage his lungs permanently. We have to look at a multiple series of folks that have recovered from this. So we don't know. The answer is we don't know. But what he can do is make sure, if he was a smoker, please, anybody who's smoking or vaping, lots of kids are vaping. Man, I tell you, you don't want to vape at this time. You're putting these little tiny microscopic respiratory droplets in your body, in your lungs, to inflame it, and then this virus comes in, whack. You're getting a double hit, and so you don't want to give this virus any opportunity to damage you, right? So, very, very important. A question came up about Advil and ibuprofen. You can, as far as we can tell right now, that there's no definite evidence that taking ibuprofen short term is going to make the virus live more. I repeat, taking ibuprofen like Advil will not make the virus worsen in your body for short term. Now, if you take it for a long term, meaning continue to take it every single day, maybe a different story, but not just for the coronavirus, but for the rest of your body. It can affect your kidneys, it can affect your GI system. But for now, I think that you can take Advil if you need to for short term. Somebody says, I think TMJ is giving them a lot of pain, and so I think that that's important, that you need to know that. Um, and MJM Speedway says, Dr. Nenny, have you been tested for COVID-19? I have not. I've not been exposed to anybody who was definitely positive, and I don't have any symptoms. So I have not been tested for COVID-19. But your question is an important one, because what's going to happen is that there'll be a time when all of us will probably be tested in some way, and that widespread testing for anybody who can who should get the test, can get it, is going to be a game changer to me, right? So if you have that, if you have that capability in our country, then changes the ball game. Then we know who's infected, who's not, who can safely go out, who needs to really quarantine themselves. Super important to know that, right? Super important to know that, because then we can control it. Then we can get ahead of this thing. And so we're doing really well. In the United States, we've approved, a couple of, I think half a dozen companies have been approved for this rapid testing, where you get to take a finger prick, blood, and then boom, it becomes like a blood glucose test, right? Or it becomes like, I'm at home, so I'm just wiping my nose. These sinuses are always fun. But you know this rapid testing with antibodies, and we can get a finger prick test that gives us a response within 15 minutes. it's going to be a ball game changer, because you're not going to be waiting for 10 days to find out what's going on, or you're going to be in limbo saying you can't get tested. All that's going to change fairly rapidly. What that's going to do, MBM Speedway, is that it's going to allow us to get ahead of this even more than we are now. So that's going to be a game changer. Very, very important. Andy Cohen says, if this comes back in the fall, do you think we have enough tests available? And Andy, this really leads to my last point, is that I think absolutely we're going to have that. We also will be able to be ahead, hopefully, on treatment, and there'll be some immunity already developed. So this virus won't have all of these folks that have no immunity whatsoever. So very important. Let me take a look at more questions here. Ali Rez of 999.Iran. Tell me, if Ali, if you're from Iran. The country's done so much to fight this virus. I have a severe toothache. What should I do? If you can take Tylenol, that'd be great. If you can see a dentist, I would, because if you have a tooth abscess, that's an emergency, right? You don't want to die from some infection because you're worried about the coronavirus, right? So I'm not saying you should go get your teeth cleaned for your regular visit. No, you're 6 months up. I got to get my teeth cleaned. Some people want to get their cleaning. That's not what I'm talking about, right? That's not what I'm talking about. We're talking about emergencies, urgent situations. Well, thank you. I got some Kleenex. Thank goodness. So we're talking about emergencies, when you have situations that could kill you. So if your appendix is bursting, but you're worried about getting the COVID, you don't want to die from your appendix bursting and getting sepsis, right? This is the point. You don't want to sit there and have a real problem kill you, so that you prevent yourself from getting a potential problem. COVID is a really serious problem. But if you have a serious issue, this is really important to understand. If you have a tumor that could potentially be, life changing, life altering, could cause death, you don't want to sit there and say, I'm not going to see anybody because I'm worried about COVID, because you have a real problem. So Ali, if you feel like your toothache is severe, see your dentist. They'll make sure that they protect themselves, protect you. Listen, I'm all the patients that are having elective procedures for me, things that, like, oh, they have a colonoscopy because they're 60 years of age and they've had polyps before. We're not doing those. However, if you're having diarrhea to the point where you're wearing adult diapers, if you're bleeding, I'm going to see you and I'm going to take care of you. And I have been, right? We do those procedures so that, we do those so we can help folks to be able to not have something change their lives, because the next 6 weeks we could be doing what we're doing now. I don't want folks to then suffer and have adverse consequences, possibly lose their life because they're worried about COVID. You should be concerned, but you should not ignore problems that are urgent and are necessary to be taken care of. So hopefully. Jane Hardy says, will we see a rise in cases after this holiday due to people ignoring the stay-at-home order, gathering anyhow, and exposing each other? I certainly hope not, Jane. And I'll give you the quote. What the folks that really look at this, Dr. Chris Murray, director at IHME, and this is an institute that looks at these kinds of things, says even if we see a decrease in the number of deaths, if we stop this stay-at-home orders or social distancing, we will rapidly go back to where we were. So your point is a very important one. If people you're hearing on the news, you're hearing me saying that maybe we've got a peak that may be coming, and then maybe New York or New Jersey have maybe already reached their peaks, but doesn't mean we stop doing what we're doing, right? You're still going to see the number of deaths that are going to continue to mount, and number of viruses, but number of virus cases doesn't mean we stop doing what we're doing. But listen, we started talking. I started doing these Facebook Lives about the pandemic. What did I say? We're going to beat this. It looks like we are. But we got to keep with the plan, right? This is the fourth quarter, right? Perhaps, right? And if you stop, anybody who's played football or seen football, if you stop tackling, if you stop blocking, if you stop running, if you stop, doing all the things that you did in the first three quarters, guess what? You're going to lose the game. We can't lose this one, right? We can't think that, okay, let's go back to work. Let's start doing all the things we did before. Very important to understand. Okay, let's continue it. Let's listen to our federal, state, local officials. Really important. Let's take a look and see what else could be. Do you know when you can get the antibody test to see if you've had it? Heidi McIlroy Van Slambrook. Heidi, I think that it's going to come up in the matter of weeks. I have been able to get some access to a couple of antibodies. They've not been approved by the FDA yet, but so we're not going to use it. But they've been approved in Europe, so we're going to get these FDA approved tests. The problem is these companies, they have to really ramp up production. But to answer your question, within weeks, and that's going to be a game changer in my opinion, because we're going to know who's infected, who has possible immunity, who has not been infected, who's more susceptible, who's positive now, who was positive previously. It's really important, especially for my colleagues on the front line. A lot of us who are taking care of patients in the front line. My partner, Dr. Qualich, he's in the hospital, and he's taking care of patients. Some of whom COVID positive, some of whom not, and hats off to all those folks. We are taking care of patients with urgent problems. I'm doing the same, and that'll help all of us to know: do we have some immunity? Do we not? So it's really going to be important. Andy Cohen says, how long does it last on a newspaper? Can I eat breakfast and read the paper? We don't know, Andy, how long it lasts, but to be on the safe side, right? If you just picked up your newspaper from the porch, probably wouldn't eat the newspaper. I mean, not eat, read the newspaper, touch it with the same hand, and then pick up your, some food and put it in your mouth. I just think that read the newspaper. When you're done with it, wash your hands and then eat breakfast separately. So listen, is that overkill? Maybe. But I think nobody really knows these answers. Nobody's tested newspaper or money, for example. It likely is a very, very small risk. But if you want to be 100% safe, you should do that. Linda Scardotus Pacorni, I'm sorry, I'm not saying your name correctly. I apologize. Can you get COVID more than once? I think the minority of people can get recurrence, but most people that we've seen from the data at Huan, that they do not get the virus again, but probably, less than 5%. We have to get better data. Can get the virus again. So I think that the key now is that we just don't want people to get the virus even once. Gerald Drake says, can allergies trigger the virus? As far as we know, allergies do not trigger the virus, but the problem is that the symptoms often are confusing, right? So I have a little bit of runny nose from the spring allergies, but the differences are, spring allergies typically give you runny nose. You get, some people get sinus problems. You don't get the kind of fevers that you get with COVID. Can you? Yes, but you typically don't get the fevers. Your shortness of breath is typically not what allergies are like. So you can differentiate those. But remember, if you have any symptoms, I don't want you to guess. I want you to talk to your healthcare provider, your doctor, and they'll let you know, listen, should you be tested? Should you quarantine? Very, very important, right? So let's see. Bill Friedjohn says, is it true the virus can survive in the freezer for a long period of time? I don't think in the freezer, Bill. I think in colder temperatures, obviously, in Huan and in the United States, I mean, we've had the virus where it's in cold temperatures. But I think if you're in the freezer, I don't think it can last without a host for more than at the most days, right? It's not going to sit there and survive for a week in the freezer. Again, you just want to take the same precautions, wash your hands thoroughly several times a day. You don't want to just blow it off. So very, very important. Listen, thank you guys. I know you've got a lot going on. This is Easter Sunday. I wanted to talk to all of you. There is lots of reasons to be positive to me. First of all, that we may be peaking, and states like New York and New Jersey, right? States where you have many more cases and other places in the world may be peaking, but other places may get their peak later. Florida and Texas could get their peaks later. But the point is that we are starting to see that the stuff that we wanted to do, right, to be able to prevent the virus from taking hold, it's happening and it's working. We have to continue the fight. We have to continue to stay within all those recommendations, right? Doesn't mean that we give up and say, okay, now we're just going to do whatever we want. Also, remember, this is not a passive fight. This is an active fight. Be a health hero, right? We never have had more time, and I talk about my 5 pillars, having purposeful living, eating the right foods. I call it a nutrition plan, 3 is movement with purpose. 4 is spirituality. 5 is community or tribe. Never has it been more important to use those 5 pillars, your health hero solutions for the pandemic. So never has there's been more focus in people's lives, right? We want to beat this virus. We want to live and thrive, right? Boom. Next is that you want to be able to use your fork. Dr. Mark Hyman, he talks about the fork as the most important tool in fighting disease. It's the same with the pandemic, the COVID pandemic, is that what you eat will really set you up to succeed, right? So I mentioned in the middle of my live today is that if you look at my kitchen, apples, oranges, we have garlic, we have ginger, we have beautiful fruits and vegetables that we eat every single day with every single meal, right? So you want to do those vitamin C, vitamin D, zinc. We are talking about real supplements that are that are going to help your immune system. We're not talking about pizza. Listen, are you going to have a pizza once in a while? No problem. But if you think it's now time to order pizza every day or eat burgers and fries every day or take some processed food every day, it's not going to be enough to fight this pandemic, right? You will be more susceptible because your immune system and your whole body will be more susceptible. I also think sleep is really important. 6 to 8 hours a day, folks. And I'm doing it. It's a struggle for me because I always think I can get one more thing done, but 6 to 8 hours sleep will really bolster your immune system. The immune system, remember, during your sleep, releases cytokines, releases factors, including immunoglobulins that can help you to fight the virus. If you don't sleep enough, those factors, guess what? They decrease, which means that you're not going to be at full power to fight this disease. This is not a passive fight. This is a health hero active fight. My third pillar, which is to move with purpose. So run with your kids. I bike with my kids every day. After this live, we're going to have a late Easter brunch and we're going to go out there and bike, right? It's a beautiful day out there. It's sunny. We're going to go out there and bike. We're going to move our body with purpose. That is going to be super important in maintaining your health. So whether it is you do it at home, whether you go outside, love for you to go outside, right? I'll tell you this, that it's so important to do that. Social distancing, you don't want to go with 100 people. Go with your family. You can go by yourself, whatever you like. Super important to move with purpose. That will improve your chances of your immune system being bolstered, your lungs capacity getting better. Take some deep breaths. Chris Cuomo, who's a CNN anchor, he's infected. He's talking about his fight with the coronavirus. What does he talk about? Take deep breaths. We don't have to be infected to do that fight. Take deep breaths. And then which leads me to spirituality. Meditation, yoga. One of the biggest things to start off with meditation or spirituality is concentrate on your breath, right? Great meditation leaders, great folks who do yoga, Tai Chi, they talk about the breath. Just concentrate on your breath. You don't have to go into a top of a mountain, sit cross-legged, none of that stuff. Just concentrate on your breath. If you can do that, man, you've already got so far ahead, decreasing your stress, decreasing your cortisol level, right? And so what that does is allows you to be able to get your health back, right? So very, very important. The fourth pillar I talked about. The fifth pillar is community. This has never been a better time for me to get acquainted with my family. We talk about the stuff that's important to us. We watch silly movies, we watch serious movies. My kids and I learned about Peru yesterday. Learned about that this was the Spanish capital, right, during the time when the Spanish Empire ruled South America. Right, it was a Spanish capital. We talked about the Incas. We talked about the Andes being the second highest mountain range. And why am I talking about this? Because this is a time to do that stuff, right? We're learning to cook together. And this bolsters my entire health. And it can bolster yours. And it really is, there's nothing good about a pandemic, but here's something that's positive, that your community is together. Super important with that. So if you use those tools, you can, along with this social distancing, along with disinfecting, along with everything else we're talking about, right? Washing your hands thoroughly several times a day, we can really get behind this. So thanks, guys, for watching. I really appreciate it, and thanks for all the amazing questions. And I'm hopeful that all of you have a safe and healthy Easter. Listen, wherever part of the world you are at, whatever religious denomination you follow, I remember it's an incredible time for millions of people fighting the coronavirus pandemic. It's a time for celebration for us to look at our humanity and how we are coming together. And it's us all the time. And so I really appreciate you taking the time. Remember, I would always say make healthy living a part of every day. Namaste. And I'll try to talk to you again very soon. Okay. Thank you for joining us.